So in the past, before we had SyncTimes, we didn't really have a good method to measure productivity other than shadowing our staff, which is super cumbersome and super time consuming and not a good measure, inconsistent across the board. So now that I can see productivity, it gives us a measurable goal.
We also use it to find out what our room utilization is and how often a room is being used throughout the week in the clinic.
When we're measuring productivity, I'm looking at intake times of my staff to see how long it takes them to intake a patient. I'm looking at times that my provider is in with a patient and seeing about how long that takes to see that we're using our appointment types appropriately. And then afterwards to see how long the patient's been waiting in the room by themselves before they are checked out.
I would say the data that we get from SyncTime alone certainly makes me want to be a provider who is more prompt with my patient. If I see that they've been waiting in a room longer than I feel necessary without talking to someone, then I will pop my head in and make sure that there's better communication going on.
Seeing how long that they're being left alone, whether or not those times are congruent with what's actually happening. As a patient, you feel like you've been left alone for an hour where it's been like 5 minutes. So being able to give back real-time feedback to the patient.
We've said, okay, well, what is the need? Okay, the patient's length of stay is however long. And we have looked at how when we increase the use of our icons, how these length of stays directly decrease. You can look at these numbers and you can look at these reports and you can correlate this data, and it's readily available. It's not that you have to go through a million different people or a million different avenues to get this, and they're easy to understand. So you can take this information, you can bring it back to your practice, you can bring it back to your teams in an easily digestible way, and you can move forward. You can implement a plan and have action and move forward.
If somebody was unhappy with their visit, or if they were happy with their visit, we want to know what we can continue to do better for other patients. We want to make sure that all the time spent with the patient and prepping for the patient is being utilized, and SyncTimes helps us do that.